Here are some of the questions that you should ask when people say this is clinically proven. Clinically proven can simply mean that one doctor gave some substance to 2 or 3 of his patients and saw some sort of change. It was in a clinic. It's that doctor's office. That's clinical evidence. Well, that does not pass muster in the scientific community. Although I am a strong advocate of natural approaches, alternatives to prescription drugs, I'm also trained scientifically, doctoral study in physiology. As a result of that, I demand that things come up to a standard of excellence. Now, what can an individual do who doesn't have that kind of training? One can ask these kinds of questions. Was there a placebo used? That means a sugar pill, to see if there was any difference in reality between the active ingredient and this sugar pill, number one. Number two, did the patient know what he or she was getting? Did the doctor know what he or she was giving to that patient? Because we've seen the enormous influence of the placebo effect, as they call it. I could go on and on and on about the books have been literally written in medicine on the placebo effect. Dramatic, in fact. So those are the two things, the placebo and the idea of what's called double blind. Neither the patient nor the doctor knew. And then in the middle of the study, cross over, so that the patients who have been getting placebo are now getting the active ingredient and vice versa. So we have a double-blind placebo crossover study. That's the beginning of finding data, the beginning. Once you've done that study, it should be reviewed by a group of your peers, MDs, PhDs, people involved in research, to examine the statistics. Were the numbers crunched properly? Was the protocol properly developed? Were there any biases that came into play or things that could have confounded the data? So that the question ultimately becomes, can I trust this to work